Hi everyone. So I wanted to share with you guys my experience with trigeminal neuralgia, also known as TN, and formerly called the suicide disease. My goal is to spread awareness about the condition and to hopefully inspire others with my story. And for those of you who have no clue what TN is, I will also explain that a little bit too. So in 2018, I started getting this dull, nagging pain in my teeth back here. I went to a lot of dentists and professionals, and they couldn't figure out what it was. It wasn't really that painful, but it was just kind of annoying, and for a year I was never able to figure it out, so I kind of just let it go. In 2019, the dull pain exploded. I was with my friend, we were making brownies, and I bit into one, and all of a sudden this severe electrical intermittent lightning strike type of pain started happening in my mouth that took me by utter shock, no pun intended there. I was completely dismayed. I was horrified that my body was even capable of producing that type of pain. From there, I did an internet search of lightning pain in the face, and all of a sudden all these things came up. Trigeminal neuralgia was the main one that came up, and I wanted to tell you what the search said. So, trigeminal neuralgia, TN, is a disorder affecting the fifth cranial nerve in the face, the largest nerve branch in your face that allows you to feel sensations. TN brings on episodic bouts of shock-like or stabbing pain in classic cases, and burning or aching pain in atypical cases. Classic TN is normally caused by a compression from a vessel rubbing on the trigeminal nerve. The compression causes the myelin sheath, like the insulation around the nerve, to disintegrate. That's basically a summary of a lot of the research I've done, just put into a short little blurb there. So my doctor agreed with me on my self-diagnosis, and so came the 5-year journey of medication after medication, neurologist after neurologist, scan after scan, and shock after shock. I came to learn the frustrations of no one understanding what I had, going to the doctor, even the ER physicians had no idea what it was, and I would have to explain a bunch of stuff, which that was scary. The attacks, they would come on suddenly. They'd stop me in my tracks completely. Many times I've gone from laughing to crying my eyes out in the flip of a switch. I don't have many triggers, unlike a lot of people, except for putting pressure on my back teeth, eating something hard back there. Sometimes if I overdo it, if I'm doing a lot of strenuous activity, but that's not always the case. Caffeine and allergy medications, for some reason, always flare my pain up. It's just pretty random out of nowhere. So from there, I ended up discovering the facial pain association. This was a little while into having TN, maybe like a year or two. So the FPA, and I attended a virtual conference there and learned about the brain surgery that could possibly fix the pain that I had, microvascular decompression. I was given odds of 90% by my doctor, so I had the surgery here with a local surgeon. I just wanted to get off of all these terrible medications and cure my pain if that was possible. Unfortunately, the surgery did fail, and it caused me to double the medications that I was on, which was a huge blow for me. And now the pain that I had was even worse and happening more often. The medications, they make me feel like I'm in a brain fog for half of the day, And even with taking all these meds, I still get breakthrough attacks. And as time has went on, they break through more and more often. So sometimes I forget words while I'm talking. I have to have, like, for example, bullet points here so I don't forget what I'm talking about. And I can have a hard time forming sentences and remembering what I want to say. So knowing this disorder is progressive, it made me want to continue to strive for a less painful future. I ended up having MVD number 2 in this year in July with one of the top neurosurgeons who specializes in MVDs and especially in redo MVDs, Dr. Mark Linsky. I'm glad I did this because he found a bunch of things that the last surgeon missed. Most notably was an artery that was trapped in my trigeminal nerve. So because of the scar tissue and that this was the second surgery, now I'm still having TN pain, but I'm only on month 4, and the doctor is very hopeful that my pain still could alleviate. He said I'm in this 3 to 6 month window where the TN pain can peak. So we just have to kind of wait and see if what I'm experiencing is a reoccurrence of my pain or if it's a healing type of pain that will eventually go away. But he said it could take up to 12 to 18 months for the nerve to heal completely. So I'm still hopeful, and I'm glad I have a surgeon that I fully trust. While I wish I could have seen an expert in TN the first time, it just wasn't feasible with my family and living here in Hawaii. It was just really hard to do that. So I would highly advise other patients to do thorough research before getting any procedures done. Read books, talk to other patients, join the Facebook groups, see who people are recommending, read articles online. Also, I wanted to talk about the mental aspect of having TN is really hard. It caused me to develop PTSD, severe anxiety, depression. I know many of us have the same struggles. The best thing I've done for that is to see a therapist. I've really learned not to assume what's going to happen in the future and to make the most out of the life I have now and just trying to be happy despite this awful thing that's going on with me. So I'm just remaining hopeful, and I encourage everyone to not give up hope. Anyone with TN knows you have to self-advocate and you have to persevere through all of this. I have personally filled my frustrations and pain into helping others dealing with facial pain through volunteering. I'm a peer mentor and awareness ambassador through the FPA. And this organization has done wonders in helping me to not feel so alone through all of this. And they provide a vast amount of reputable knowledge on TN. And this is just something that I refuse to let consume me because I'm a mom, student, I'm a wife, and just have too much to live for. And I appreciate everybody listening to my long video, and I hope you could get something out of it. And thanks for listening.